Wesley Health and Wellness Center, set in San Antonio's Columbia Heights neighborhood, serves those who may otherwise be left unserved.
The Wesley community has always been either a transitional community for people who are poor, who are moving into stable jobs, or at one point in time it was probably the hinterland, the farmland of San Antonio. Just like North Star Mall was farmland, or this area that the medical center was in was farmland many years ago. So it was probably the in-stream stopping point for lots of migrant workers from Mexico for lots and lots of years in the past. And so Wesley has always been a place where services could be provided to a population that's working at very low-wage jobs in San Antonio and elsewhere, and the family members' children typically weren't getting health care. And so that's the role that we played in that organization.
There's so much need that we as a society are not doing a very good job of addressing. Physical needs, spiritual needs, medical needs, dental needs, and there are lots of places in San Antonio doing similar things to what's happening here, but there's still a whole lot more need for even more. And I'm fairly strong in my feeling that church-related organizations should be doing ministry better than the civic government is doing, should be providing services better than other organizations should be doing. And I think that's what we're trying to do here.
The Wesley Center is critically important. The life of families living in poverty is one wherein they struggle to make ends meet from day to day. And the Wesley Center provides the safety net to make families survive from one day to the next. And this comes by way of the financial assistance that they provide, the counseling services they provide, the crisis intervention that they provide, the much needed health care and dental services. It is an important facet in this community. And so the Wesley Center and the work that they do is part of safety net for families.
The Wesley Health and Wellness Center honors the same mission as that of a century ago. The center serves humanity to honor God.
The way Wesley began back in 1909 was 5 women from Travis Park United Methodist Church saw these children playing out in the streets, and they were immigrants from Mexico, and their parents just left them playing out there. Well, they started a lunch and restroom in the church for these young people.
Well, the Wesley Community Center was built in the concept of the settlement house movement in this country. Settlement homes, as they were known, were centers like the Wesley House that served to socialize, integrate recent immigrants. And they did that by providing a wide array of services, English classes, citizenship classes, a lot of social services, and the objective was to help people with their daily lives, making ends meet, issuing emergency food baskets when people did not have food, helping families with their utility bills, certainly helping families with the many different problems of family life, helping youngsters with gang, to try to keep them out of gang activity and criminal activity, teaching American values, and all in all, integrating recent immigrants into the American way of life.
I first became involved with Wesley in 2001. I came down with a group of folks from my church to an open house, and that was my first encounter with Effie Nell Grimes. And the purpose of the auxiliary is to serve as a liaison between the center and the Methodist churches. The auxiliary has an ever-expanding role in the program of the center. The auxiliary was actually started in 1920, and it was then known as a board, and it consisted of the presidents of the United Methodist Women. And in 1975, under the guidance of Effie Nell Grimes, the auxiliary was formed and has been known as the Wesley Community Center Auxiliary since then.
In 2008, Methodist Healthcare Ministries broke ground for a 47,000 square foot facility. The building was completed just 1 year later.
It's not real for me. It seems like it's a dream to see that big, great, huge building with all those. You have a medical deal, you have all kinds of resources to help the people that are in need of those resources.
The biggest thing from the medical point of view that this building allows us to do is we are doubling the size of all of our facilities. So we can have twice as many doctors, hopefully at least twice as many services. And we are in many ways better integrated with the other components of the community center, and not quite as spread out and not quite as crammed for space.
The primary health care is doubling in size, so it's going from 2 to 4 physicians. The dental care is probably going to get up to 8 or so dentists. There are double the number of dental chairs there. There are enormous improvements in the social work areas, the counseling areas. We've moved into parenting programs so that the young moms and young dads have all of their programming there for the community. And so, the building's enormous size is almost full with all of the additional medical, dental staff and social work and counseling staff that we've moved in for that community. And so we'll be providing a lot more services at a lot more cost to us over the next several years out of that facility.
I think the new building is great. There's a lot of improvement. There's a lot of rooms for children. There's a lot of rooms that they use to teach, like sewing and quilting and crafts and all that. And I think it's a very nice place. They have really improved it.
Oh, this is so fantastic that they never imagined they'd see anything so beautiful that they feel like they're in the north side. And I just laugh at them because they make it so funny. They said, we never thought we'd be, it's like going to one of those rich clinics. And I never thought about it that way. A rich clinic, I mean, I guess that's the way they see it if you don't have insurance and then they come to us. But now I had this one patient say, it makes you feel even more important now. I says, well, good, I'm glad. I'm glad, and I hope we can continue doing this. And I hope that our building stays as beautiful as it is now for the next 20, 30 years. But you can see people that they really, really appreciate it. They come, they appreciate it, they say how beautiful it is. They're just very happy with the building.
For more than a century, Wesley has changed the lives of those in the community and those who serve it.
Everything I've learned, the resources, all my co-workers, everyone that I work with, I thoroughly enjoy it. It does change your life, and it changed your life. I think it's changed mine tremendously because, like I said, I'm a loner here with just my children. I don't have any family here in San Antonio. And being around all these individuals and all have made me be an outgoing person. I mean, my life has changed in comparison to what it used to be. And if I had it all over to do again, I'd do it again. If MHM would take me again.
I felt Wesley gave me that insight, gave me that feeling, inner feeling. It was not I was expressing it, although I didn't know it until later in life when I look back. I said, "What? How did I snap out of this thing?" First of all, I got rid of the speech impediment because of Wesley. So Wesley gave me the inner feeling that I belonged. But I belong in society, not on a corner, isolated from the rest of people. It taught me how to mingle, how to get around with people, and how to appreciate people.
The Wesley House, and certainly the Methodist Church, which Wesley House was an instrument of, they had a major impact in my life. They took me out of gang activity, enabled me to go back to school. And when I finished high school, that's when they offered me the full-time job. And then they offered me a scholarship to go to San Antonio College. College was not anything that I had ever envisioned, but the staff at Wesley served as counselors and as role models to show me that there was a different way of life and that way of life was very much within my reach.
I think in a way it has helped me fulfill my mission in life to serve God and serve man. It's been special. And it's not only changed my life, I've been able to communicate with all the churches in the district and be involved, getting them involved. And it's been wonderful, the number of volunteers and people who have given them themselves wholly to this place. So I think it's changed my life a lot. I've learned a lot. Mm-hmm.
This place, this community, a century of service. Wesley Health and Wellness Center.